Hi, Mr. Smith. I'm Carissa. I'm going to be your CNA today. I'm going to do my hand hygiene, and we are going to do some catheter care and empty your catheter measuring output. So first I'll grab my gloves. I will close the privacy curtain. And then for this skill, we're going to need 3 washcloths, soap, an alcohol pad, a Chuck's pad, a graduate, a recording form, and a basin of warm water. And then go to our patient. I'm going to raise the bed. Okay, and then we're only going to expose the area we're cleaning. And then we're going to visualize and make sure there's no kinks in the tubing, which there's not. And then we'll take our first washcloth and we'll soap all 4 corners. And then the first thing we want to do is we want to clean the area where the catheter meets the urethra. So we're going to clean around there. And this could be on male or female. We're going to get a new corner. And then we're going to pinch where the catheter enters and pull but not tug on the catheter. And you can do that with your remaining corners or you can be done. Put that in the laundry basket. And then we're going to rinse the same way. So make sure we have our 4 corners. So we're going to clean around where the catheter meets the urethra. New corner. Grab where it enters. Pull but not tugging. And then you can keep going or be done. And then we'll pat dry. And I like to use a new corner every time I lift up. Okay, now we're going to cover him back up and we're going to empty the urine. And not walking away from my patient, but grabbing my graduate, alcohol pad, and Chuck's pad. I'm going to use the height of the bed to help me empty the catheter so that we don't touch the edges of the graduate. Want to completely empty. And then before you put it back, we alcohol swab the end. Okay, now we're going to grab our supplies. And then I'm going to lower him before I walk away. And then take our bucket and our soap as well. Put our soap back. And then we'll put this in the trash. Before we measure this, I'm going to empty, rinse, and dry so we can put it back. And then we'll take this to where I have my recording form. And then put it on a flat surface to measure. So we'll write down what we see, which I see 150, and we'll put that in our urinary output here on our recording form. And it's in mLs always, not in ounces. And then that is for our test observer. And then we'll come to the sink. But we are never going to dump real urine down the sink. For testing purposes, it's okay. But we can verbalize we're dumping down the toilet. And then we'll rinse and dry. And return to storage. And then we will take off our gloves. Mr. Smith, here is your call light. Here is your water. And then we will go wash our hands after this skill.